Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome back. My next guest is Dr. Joesph Gerhardstein, who is going to talk to us about healthcare wearables. And with the advent of the cell phone, we can do a lot with healthcare wearables. One of the things they've been advertising on TV lately is a little car, I think it's called Cardia, and you can monitor your heart rate by putting your fingers on that little device. Is that helpful?
I saw a patient last week with one of these. It's a young woman who was frustrated because she was having what she felt some palpitations, and according to her monitor, she was in atrial fibrillation, according to what the monitor showed. Now, when I examined her, I did an EKG and I reviewed the whole thing. It was entirely normal. There was some artifact in there that the monitor. On the other hand, I've also had people come in to see me say, Joe, I think I'm in atrial fib. I said, well, why is that? Because my phone told me. And I pull it out and it looks like they're atrial fib, and then I do a EKG and it shows that they're in atrial fib, and I can treat them appropriately.
So sometimes this helps, sometimes it just muddies the water. But if you want to go the next step, you can do the next slide, which is a more involved, what we call a Holter Monitor. Is that better?
This is much better technology. You get a real EKG that you get hooked up to a monitor here. It usually monitors for people for 1 to 3 days. Sometimes there's some artifact with those too, because people use this while they're driving, they do it while they're exercising. But they're excellent ways to help detect potentially dangerous, serious heart arrhythmias.
Or also tell you that that palpitation is really not anything to worry about.
Correct.
All right, now I mentioned at the beginning smartwatches. Do they really help you? Do they keep you healthier?
Well, I think the more we individuals know about our health, the better. I get people say, I get plenty of exercise. I say, well, what does your watch tell you? Well, I get 5,000 steps a day. I'm like, well, you're young, you should be getting double that. You know, so I think looking at how many steps you get can be real important. Some of these things also will tell you if you have some kind of cardiac arrhythmia. They've even, some of them will monitor you while you're sleeping to see if you're sleeping well or if you have some kind of a sleep disturbance.
Okay. The next one, you mentioned sleeping. Sometimes you can use a pulse oximeter. Tell us what that is.
You know, COVID has been very good to the pulse oximeter companies. This is something that we've used in the medical field for years. If you're in ICU, we can check your oxygen level. If you come into my office and you're having some chest pain, shortness of breath, it's really easy to check it. But when COVID struck, a lot of people were getting sick, and we were trying to monitor them at home. Do you need to come into the hospital, or do you need to stay at home? So they can get these over the counter. They're fairly inexpensive, extremely easy to use. You put this little thing on your finger, push a button, tells you what your oxygen level is, what your heart rate is.
What is the oxygen level that you worry about?
So for me or you sitting here, it's going to be in the high 90s, 95, 96, 98. Probably not going to be 100. Once it starts getting around 90, then we start thinking there's a problem here. We need to take some further action.
So it's good monitoring if you're getting into trouble.
Yes.
All right, the next one is hearing aids. A lot of old people, I guess I'd put myself in that, can't hear too well. Is it beneficial to fix that problem?
Hearing is extremely common as we humans get older. We see it in young kids too, but not so much. It's been associated with dementia. Anything you can do to combat dementia, I think it's extremely helpful. And fortunately, next month, October, they're going to start selling more of these over the counter. Right now, you go to a hearing specialist, you walk out with these, it may be $4,000 out of your pocket. But starting in October, that price should come down substantially.
And a lot more people have access.
Yes.
That'd be good. This is a cochlear implant, which is different, though, than a hearing aid.
So where people have severe hearing problems, and you can tell this looks like a little kid. Severe hearing problems, they've already been through the hearing aids, and maybe it's helped, but maybe it's not. This is a device that this hooks directly into the brain and augments their hearing. So it does extremely well in somebody who's had some problems and failed hearing aids. It's surgically implanted, so there's a little bit invasive, but it's a fairly minor procedure.
Okay. Next is glucose monitoring. We used to stick our fingers, but now we've progressed where we can do it continuously and know the numbers all the time.
It's so easy. You take your cell phone, click it up there next to your phone, you can get a reading of your phone continuously. You put the little sensor on, you may leave it on there for a couple weeks, so as you know, you're not poking your finger 2, 3, 4 times a day. It's been shown to help people to monitor their glucose, get their hemoglobin A1C, get their blood sugar under better control. Some of that's because when you ate that big serving of pasta and then you check like, oh, I shouldn't have done that.
But if you do it and you have the next slide, which is an insulin pump, you can give yourself a little extra insulin and wear that pump to be more normal.
We're getting better and better, trying to more closely mimic what the pancreas does in a normal individual with one of these devices. It's hooked up to your skin, it gives a small insulin drip continuously, and then when you're getting ready to eat, you push a little button, it'll give you a little bit extra insulin.
Technology a long way. What about blue light? Is that important?
Blue light has been found to keep people awake at night. A lot of people watch TV, playing on their cell phones, and they want to go to sleep, and they can't. And so they come in and see me, give me a sleeping pill, Joe. I'm like, well, what are you doing before you go to bed? The other thing is we're spending a lot of time in front of our computers. And if you can filter out the blue light, these are blue light glasses that I got at a pharmacy. So it's not expensive, but it can filter out the blue light and can help eye strain.
Might help your sleeping problem also.
Yeah.
All right. The last one here is rings. Now, that's something I've not seen. I don't know if you've seen it. At least the jewelry doesn't look too bad, but do you think it's going to lead to anything more?
You know, this will do the same sort of thing you can do with your smartwatch. It's a little prettier. Is it going to save lives? I mean, if it gets somebody interested in their health a little bit more, counting their steps, being more active, seeing if they're sleeping right, I think it's an interesting thing for the future.
Well, we'll look forward to that one.
Yeah.
I appreciate you coming in. Thanks for the information.
Thanks, Jeff.
Healthcare Wearables. We'll be right back.